Welcome to our Scale Community Technology and Innovation within Healthcare podcast, where I'm joined today by Bruno Piquin, the CEO of Ensure Data Solutions, an interesting business focused on data analytics and performance improvement within the value-based care market. And looking forward to exploring that market holistically and then specifically the technology that Bruno and his team at Ensure Data Solutions have developed to serve that market. Firstly, thank you, Bruno, for joining us. We're excited for the conversation. And like to begin with just maybe a quick background. I think you bring a lot of relevant experience from different pockets of the healthcare market beyond technology. So maybe just as foundational context, if you can begin with a quick overview of your background, that'd be great.
Yeah, absolutely, Jason. And thanks for having me on your podcast. So I've spent most of my career on the payer side. So a little bit over 30 years or so of experience with various lines of business, but really the last 20 years mostly focused on government programs such as Medicaid managed care and long-term care and Medicare Advantage. And just about 2 years ago, after I left the payer side, went over to the healthcare information technology space, supporting some of the needs and delivering solutions for issues that I got to experience and heard about when I was on the payer side.
Wonderful. Before we get into Ensure, I want to spend a minute on the market side, but I think just as context, can you just quickly describe what Ensure Data Solution does as context before we jump into the market?
So we operate we operate in the primary care, value-based care space. We also do a little bit of specialty care as well, supporting some of our clients that are doing chronic case management and care management and TCM. But when I look at really the composition of the services that we provide, high percentage of that is really supporting payers and primary care groups that have engaged into some type of value-based care arrangement and supporting the data ingestion, data cleansing, data analytics, and also with some population health management tools to look at the data and what the analytics is suggesting, and recommending some course of actions, some actionable insights from the perspective of a clinician that can actually do something and improve health outcomes of those patients that he or she is seeing.
So you've seen a lot. You mentioned 30 years and you mentioned a lot of payer experience, United, Amerigroup, Care Plus, Humana. So you've been across different payers, you've been across different lines of business, and you've seen the value-based care market over time, which brings unique perspective. And so I'm just wondering, after all that experience, what was it that attracted you to Ensure Data Solutions? What was it that you saw as a gap in the market or the opportunity in the market that said, now's the right time to join Ensure Data Solutions, and this is the product that the market really needs?
The issue that I saw when I was on the payer side was, and the feedback, quite frankly, that I got from a lot of provider risk partners that we were working with was the fact that, again, those providers, for the most part, were providers. They started their practices to deliver care. They did not start their practice with the thought of having to have a large IT department or a data science department to analyze the vast amount of information that, quite frankly, is needed, but also generated through the collaboration that exists in a value-based care environment, collaboration between a provider and a payer. So that was probably the most relevant information and feedback that I have gotten, that and quite frankly, obviously, a problem that needed to be solved. Sure, you get some of the larger payers or larger primary care groups that have the infrastructure to deliver the information in a way that is usable and ready to be used and ready to act on. But in many cases, that was not true. And so this is really what led me to where I am today. And tried to solve the problem because I am deeply passionate about value-based care. I've seen what it's done, and I certainly saw it from a payer perspective, but also collaborating with those risk partners. It was very obvious to me that there were great results that could be achieved and get achieved, and ultimately who benefits from all that are the patients. And so anything that I can do for the rest of my life to help this level of collaboration continue to exist and address the problems of the healthcare system, and making sure that because at some point I will be a retiree myself and a Medicare beneficiary, and I certainly plan on seeing physicians that believe in this as well, the way I do. And again, value-based care is not just for Medicare or Medicare Advantage. It does exist and does well as well and can benefit patients in other lines of business, such as Obamacare /ACA or Medicaid managed care, or even the commercial space.
So with the adoption of value-based reimbursement, risk-based reimbursement, providers being asked to solve for a pretty broad ecosystem, and therefore you guys fill a middle piece of simplifying the landscape for them of how they're performing, what needs to be done, and solving for missing gaps in IT expertise that would otherwise be required internally for these practices to execute in this market. Is that a fair summary?
It is, absolutely.
So with that, maybe we can zoom out and focus on the market for a second. Value-based care market, risk-based market. And is it both of those things? Am I right in lumping value and risk together? Do you view value-based care market as different from risk-based market?
No, I mean, I think we can use those terms interchangeably here. I think the old term was risk contracting. I think it may not sound as well as value-based care, so I think most people now have moved over in that. I think value-based care is a better representation or better description of what it actually is.
So for a long period of time, there was a lot of excitement on this market, the value risk-based market, particularly within the MA market, but also, as you mentioned, Medicare fee-for-service and even beyond Medicare. And it was driven by shifting payer regulations, benefits to the patients, benefits to the payer, so societal benefits, and then also financial opportunity as these particular primary care moved upstream to capture a greater portion of the risk and therefore a greater portion of the potential earnings. That drove a lot of investment, that drove a lot of euphoria as well. And then we saw some headwinds in the market, some companies that didn't perform, maybe they grew too quickly, some challenges in execution came to bear, some of the realities from a working capital perspective of what needs to be invested in different departments, long timelines for reimbursements to be realized on some of the risk-based reimbursements, and particularly until you get up and running on your cycles. So what is the morale of this market today? Does the euphoria, does the excitement prevail? What are the latest trends from a regulatory care delivery perspective that you're focused on? So give us a feel for the climate of the market today.
Yeah, no. So I think some of the excitement around value-based care, and specifically if you look at it from a Medicare Advantage perspective, certainly existed up to about a year and a half ago when I think a few changes and a few factors drove maybe a lower level of excitement in that space. I think those can be probably summarized around version 28 that was introduced, version 28 of the risk adjustment model for Medicare Advantage. So I think the industry was probably not very well prepared to manage version 28. So I think there'll be an adaptation process and period. I think another key factor also.
So in layman terms, what did version 28 do for those that aren't familiar?
Yeah, so it removed a lot of the clinical conditions and diagnosis codes that were present. Removed those from the risk adjustment model. So again, you've got an industry that get really comfortable and quite frankly, a bit of an expert at identifying, suspecting, documenting, and coding certain clinical conditions. And about a little bit over 2,000 of those diagnosis codes get removed from version 28. Those existed in a previous version that is called version 24. And so again, I think it's going to take a little bit of time for the industry, both the payer and the provider side, to be able to recognize now and adjust to this new model. So I think this is one. I think another factor also that's been driving a lower level of excitement in the MS space is what I would describe as the runaway supplemental benefits. I think there's been a shift also from providing benefits and services and healthcare coverage in the Medicare Advantage space and products, shifting from that where there was some medical necessity that and clinical decisions that could be made in terms of the appropriateness of certain services, and shifting from that environment to one where on the supplemental benefit side, where it's a little bit more of an allowance defined type of benefit package, where it's here's a certain amount of money for the year as an annual benefit, and go spend it. So I think that has been put quite a bit of pressure also on this level, on the margins, on the surpluses that were being generated and could be reinvested into the infrastructure. So I think those are what I would probably categorize as the two main issues within the Medicare Advantage space. Now, I think there's still a fair amount of excitement and a high level of excitement in some of the other lines of business. So I would say I mentioned Medicaid managed care. I think there's still a lot there that can be done, and I think it's a population obviously that needs it tremendously. I think that we're starting to see a little bit more value-based care type arrangements and collaboration in the ACA space as well. So I think that that's something that's very much real, and I think that's going to continue to expand. And from an ACO perspective, so that would be your original Medicare program. I think there's still a ton of excitement when you look at the number of new entrants and new organizations and new applications in the ACO space. I think that's very telling. And I think when you see the annual savings that are generated by those organizations and by those programs, I think it tells you a lot about the need of value-based care and the fact that it's still very much needed. And there's still a lot of waste that needs to be taken out of the cost structure.
Part of what I'm hearing is there's still opportunity, but there also does seem to be a lot of downward pressure as we as we learn more about which codes truly drive risk adjustment. Some codes get dropped out, and so they're no longer pushing up risk adjusted reimbursement because they're not part of the risk bundle. Supplemental benefits on the other side are an expense, and so driving down margins. And so you're being hit from different directions as a provider on your potential opportunity. And so ultimately, as you say, this is the goal of all this, is to deliver better patient care defined as high quality, appropriate care, avoiding unnecessary waste, and also cost efficiency. But the financial component of it is key because it creates an incentive. That's the whole concept behind value-based care, risk-based reimbursement, is aligning incentives. And so I want to try to put framework around, as imperfect as it may be, a framework around what we're experiencing. So historically, if I were primary care and I earned $100 in a fee-for-service world, in a risk-based world, I can earn how many times that $100? So my opportunity is to grow my income 5x, 3x, 1x, 2x. And I want to ask that question, 3 years ago, in sort of in the height of this, and then I want to ask that question now post these changes. Does the opportunity get reduced, from 10x down to 8x? And so, yeah, it's not 10, but it's still a tremendous opportunity measured as 8 times more than these providers were earning before. Or does 10x become X with plans for 2x to get us right back to where we were before, earning as much as you were in the fee-for-service world? I know it's a hard question, but I just want to try to push to general broad strokes parameters.
Yeah. So I think if you look at it purely from a Medicare Advantage perspective, I think, some of the things that I mentioned, kind of the cost pressures, and specifically around supplemental benefits, I think, there's some things that CMS is thinking about, along the lines of what's really the value of those supplemental benefits. And so I think that CMS finally introduced for contract year 2025, some requirements for health plans for the payers to actually look at some of the supplemental benefits programs and the value that they're generating and explaining that. So I think it's not this laissez-faire type approach anymore. I think CMS has realized that there's a need for health plans to demonstrate the return on the investment for those benefits. So I think the runaway factor is probably going to start subsidizing or coming down or regressing a little bit over the next few years as payers are really pushed to think through the return on the investments. So going to and trying to translate that into what this means from a multiple perspective. I would say that we will markets adjust. They find a way to find a way to continue to exist where the opportunity is there. And what I'm telling you is it may not be as high as what it was before. So using some actual numbers, and yes, it is a pretty difficult question to answer because also you have to look at the type of population mix that you're dealing with, the geographic environment or location as well, because it may drive also some variances. But I would say that it may not be as high as what we had before, but it will be certainly more than it will continue to exist and create more value than the straight fee-for-service environment. That is something that I'm confident about.
If I could try one more time to push you on a number, and I know that I know that it's a very difficult number, but let's define a well-run MA focused program, and just broad strokes of, and maybe an easier way to answer it is, let's say the heyday is, what percentage discount are we going to be to the heyday when the dust settles? And you could say less than 20%, 20 to 40, 40 to 60, 60 to 80, or 80 to 100, which 80 to 100 means we're right back where we began.
Yeah. So let me say this, because there's a data point that's been published by one of the payers that is a strong believer in value-based care, and it has a very large percentage of its MA population in value-based care arrangements. And that study, last time I saw it, I think was on 2023 experience, I think. And it was still I think it was a fix, I believe, comparing value-based care compared to fee-for-service. I think it would be important to look at, obviously, that trend and where that data point is for 2024, and see if it continues to be a high percentage, or if it's a multiple that is sustainable and continues to be at that level. But right now, at least for 2023, this was probably somewhere, again, the 5.5, and that was more of a national number. So
still, but meaningful upside.
Very much so. Very much so. I mean, listen, just look at the ACOs today, understanding it's a slightly different approach because it's more shared savings. But at the end of the day, it is still very much, you continue to see very strong performance by the ACOs. That tells you that, and that's not as easily controlled, and you don't have necessarily all the bells and whistles of utilization management that you can find on the MSI, and it is still very significant savings that are being generated. So,
because look, as you know, and partly why Insure Data Solutions exists is to achieve successful performance in this market is not easy. And so the 5.5x is, if you do it well, it's the summary output, it's the reward for taking on a complicated, risky business. But the journey to get there is significant investment in technology, significant investment in building out new operational programs. And so the cost associated with that higher revenue is higher. The capital expenditure required with that revenue is a lot higher. And so I think from a market perspective, it's very important that the reward remains reasonable, commensurate with the level of lift, commensurate with the level of investment, commensurate with the level of risk associated with migrating to this. And so if we believe that there's a societal benefit and we believe that incentives matter, then it's important that that incentive prevails and that incentive is fairly meaningful given how much complexity there is along the way. So then I want to come back to one more macro question. So that's sort of on the incentive side. And then I want to go into insure data solutions. The question on the macro side is, is it all working? Okay, you've articulated that there is upside. There is noise in the market as we learn, as we've adopted, we've tweaked the model, and we're going to continue to do that. So, some of the initial reactions now have created headwinds, but some of those headwinds will be corrected through different types of regulation on supplemental benefits and things of that nature. And so is the model working? And what macro indicators do you look at to understand whether all this noise around this transition to value-based care is actually achieving the objectives of higher quality care with cost efficiency along the way? And within those indicators, any views about how we're performing?
Yeah, so I think one success factor around value-based care is collaboration between payers, providers, and quite frankly, patients. Patient engagement is very important. Part of that collaboration is also, and successful collaboration and extensive collaboration, it exists through exchange of information. So making information readily available to those that need it is also critical there. And so usually that's clinical information. So one thing that I still see as an issue today is the lack of interoperability. It's still very much siloed. We're definitely making progress again, and some of that progress is supported by policies enacted by the government. So one example of that is the expansion of the meaningful use definition for electronic medical records or electronic health records and any type of technology that is being used in the healthcare system. And so expanding the meaningful use to also include interoperability, I think is something that is a great step forward to try to resolve that. But the market is still a little slow at reacting to this type.
What does that mean?
Of expansion.
Okay, let's say that happened. Meaningful use was expanded to include interoperability. Is what you're looking for that, EMR1 talks to EMR2, so ECW, eClinicalWorks, EMR talks to Epic, EMR talks to Athena, or that there's what do you have in mind with interoperability?
Exactly what you described. So it's systems that are being used, technology platforms that are being used in the healthcare industry, and they're all talking to each other. And what I mean by this is a very simple example of a primary care physician doing some blood work on a patient, seeing something that looks needs additional attention and probably attention of a specialist, will refer that patient to a specialist. The specialist is going to say, okay, well, I understand this is your current condition. Let me validate this. Let me do some blood work on you as well. Now you've got two tests that have been performed. One is too much. We shouldn't have to. The primary care physician should be able to share that information and the results of the blood work with the specialist. The systems should be able to talk to each other so that that information that is contained in the PCP's EMR gets passed on to the specialist EMR. And so you're experiencing extra cost delays in care, and ultimately it creates waste and increase in the cost of care.
So interoperability, we've got more work ahead, but are there metrics where you have seen positive change, whether it's, avoidable ER admissions or, controlling of drug spend? Are there any clinical metrics that are indicators of success, tangible?
Yeah, no, absolutely. I think what you're seeing today, there are some organizations that are publishing basically the type of results that they're able to achieve. And one metrics there is clearly, the 5.5x we were talking about earlier. So if you continue fee for service, you're going to be 1x. If you are moving to value-based care, you're creating this X. That means you're taking cost out of this, in removing costs from that baseline. that's being used. So you're seeing this, you're seeing definitely readmission reduction. So again, CMS has a number of programs, pilot programs in some cases, that were constructed through the Innovation Office, CMMI, and you see a number of those programs that are generating meaningful and significant improvements. And again, who benefits from that? The patients. You also have beneficiaries in the case of Medicare. And quite frankly, taxpayers, because we're all funding the Medicare fund today.
Yep. Great. So let's shift gears now to Insure Data Solutions. So you gave us a quick intro of Insure, but let's go to the deeper version of Insure. So in the context that you described, what specifically is Insure doing for its providers? How is it doing it? And what's the value prop and the goal of what they'll be able to achieve by working with you?
Yeah, so we Insure Data Solutions today supports 4 lines of business. So Medicare Advantage, the ACO program through Original Medicare, Medicaid Managed Care, and ACA products. And so what we do is we capture data from 3 sources: payers, the EMRs, and other repositories of clinical information, and then also HIEs. Most of the HIEs around the country today transmit ADT notifications, admissions, discharge, and transfer notifications, real time or close to real time. So we ingest all that, we analyze the data for our clients, and develop basically actionable insights. So all the analytics, there are many platforms out there that do analytics, and that's great. But what you do with the analytics is even more important, and delivering that to those that can actually do something about it is even more critical. And this is how you move the needle. And what I mean by that is being able to push back to EMRs the suggested course of actions or suspected conditions that may need to be validated by a clinician, pushing that back to the EMRs. When you think of a clinician, the 2 most important tools are probably, one, their stethoscope. The second one is probably the actual device that they use to access their EMR platforms. And so pushing data back and that information back to this actionable insights to the clinicians is really important. And again, this is how things get taken care of. This is how a treatment plan gets adjusted or developed to treat a condition or prevent one from worsening or even happening. So again, with predictive modeling around risk of hospitalization, risk of stroke, risk of cardiovascular conditions, and other models, we are able to, by aggregating the data, putting this through artificial intelligence and other machine learning models, we are able to identify some of those conditions or develop recommendations or suggestions for clinicians to take action on. So that's, in a nutshell, that is what we do today. And again, supporting those providers, those clinicians around their population health management programs.
Would you describe the back end of what you've built as primarily a data analytics exercise? Marrying up, for example, I'll go back to the risk adjustment codes, but marrying up the sort of approved risk adjustment codes that have been defined by CMS with a patient's condition, analyzing the 2 together, or is the back end more clinical in nature, where you have to really understand the conditions and the clinical workflows, or is it both?
A little bit of both, but it starts with the data analytics. Again, this is a strong component of the collaboration that exists in a value-based care environment. Again, that's this exchange of it starts with that, analyzing it, and supporting the clinicians do their population health, and those value-based care providers do the population health protocols and programs, but also supporting them with patient engagement. So that's another very important piece of what we do, is helping them and be an extension of them to some extent around remote patient monitoring, for example, or expanding their view of the patient's clinical profile by, again, bringing data from outside of their practice. Because when you think of a specialist or a primary care physician, their understanding of the patient's clinical profile is really contained in their EMR and limited to their EMR systems, or at least the information that's in there. there's a lot more that may happen outside of the walls of that specialist office or primary care office. And that's what we support by bringing this stick, enriching, I guess, the information that is in their EMR to make better clinical decisions and drive better health outcomes.
Who's the right client profile for you? Is it a group that's early in their transition from fee-for-service to risk? Is it a large-scale, mature risk-based organization, something in between? Where do you fit, and where are you targeting your product?
Yeah, so I think we've got a little bit of both, but in general, the ones that have benefited the most from what the tools and services that we provide and solution we have is you're going to have the payers we've got payer clients that are more on the smaller to mid-sized clients, health plans. We have primary care groups that don't have the desire or don't want to get distracted with hiring, training, and managing a data science department and a medical economics department or resources. So we've got again, lots of focus today on primary care. We do have a few clients also that are in the specialty care space and some that are in the chronic care management space. So in summary, I would say small to mid-sized health plans that are operating Medicare Advantage program or Medicaid managed care or ACA. We've got a few ACOs also on the platform. And those are either startup ACOs or those that have been in place for a while. We do have, believe it or not, also a couple of billing companies that we support. Our coding module helps them with the chart reviews and coding validations and the billing piece of it. So that's it is not a revenue cycle management tool, but it supports coding and coding validation. So that's kind of the spectrum of the clients that we support today.
You mentioned a few times about the chronic care management, specifically for specialty care providers, so beyond the primary care market. So can you expand upon the type of work that you're doing with specialty care providers?
Yeah, and I would augment that by also saying health systems, so in hospitals. So you have some incentives on the original Medicare side or in the original Medicare program, again, through CMMI initiatives, a desire and a program that exists to reduce readmissions. And so there are incentives in place today to make sure that a readmission does not occur. So, and specifically for those that are severely ill patients. And so making sure that they have everything that they need at home. Because at the end of the day, probably the most cost-effective place of service is going to be the home of a patient, and it's making sure that they have what they need, and especially if they have the tendency of being homebound or room confined or bedridden, accessing care is not easy. So typically they're going to access care in a moment of crisis, not from a preventive perspective. So this is how we support some of the specialty organizations, specialty care organizations, and health systems around, again, TCM and CCM.
Given that your product is relevant to primary care, it's relevant to certain pockets of the specialty care market, different sites of service. You mentioned hospital, obviously the practice, you mentioned home care. Is there a role for Insure Data Solutions to solve for interoperability, or that's really got to be the job of the EMR, because the EMR, at the end of the day, these providers of the specialty care practice will actually want the lab report results, not just the data that you're aggregating?
Yeah, no, we it's definitely a role, and quite frankly, the way I look at it, just because I'm passionate about what we do, we have a duty to solve for that. And so it's working with various healthcare technology platforms. Any technology platform that holds clinical data for us is in terms of connecting and interfacing with those. I would tell you interoperability is also the most efficient and also a very secured approach to exchanging clinical data. So to us, it's we definitely have a role and a duty to contribute to that. And we do today.
What is the implementation experience like? Timeline, level of complexity?
Yeah, so depending on obviously it depends. It varies depending on the clients, but We've done implementations in single days. That's where the client had everything that was needed. So if you're thinking about, let's say, a provider group or management services organization that has affiliated providers, having the provider roster and access to all the files, and have an EMR that meets the requirements of meaningful use. And if they have in place already a contract with a HIE, or if we are contracted with the HIE in the geography that they operate in, it can go extremely fast. But usually the average experience is more around 2 to 3 weeks is typically what we see.
Okay. I want to look forward to sort of your product roadmap and where you're planning to build, what you're excited about over the next 5 years as you continue to develop the product. And maybe as part of that, I'll squeeze in a second sub question around strategic partnerships. So we're very interested in this theme of strategic partnerships in healthcare. And particularly, I think the technology market plays well to that concept. But for us, it's so core to improvement in the market, because when you think about what's being asked of these providers, in particular in the risk-based market, they're solving for an entire ecosystem of patient care. And so whether it's interoperability or strategic partnerships, how do you effectively do that to the fullest extent without meaningful coordination with other providers, other services across the ecosystem, and at its fullest extent, collaborating is a strategic partnership? So the overarching question is, as you look forward, what are you thinking and excited about from a product roadmap? And the sub question is, what role do strategic partnerships play in that roadmap for you?
Yeah, so let me answer that in the reverse order, if you don't mind. I would say, so strategic partnership to me are super important. And the reason those are super important, when I look at what we offer today on the platform, I would say a large percentage of that came from collaboration with clients, understanding their needs. And so when I look at strategic partnership, it helps us also define the roadmap. It helps us understand the needs and anticipate some of the needs and see what's coming ahead, what's coming at us, whether it's from a regulatory perspective or just market trends in general. But that's a way for us to expand with experts by getting that feedback from those clients, experts at what they do, expanding our service offering, and quite frankly, sometimes even improving what we have today. So that's one. Two is obviously maybe a little bit more selfish, but also feeding into this passion that I have about value-based care. It helps us accelerate the expansion of the solution that we offer. So as an organization, obviously we benefit from a growth perspective, but then also making people realize how important and how valuable value-based care is, and for them to be able to get to benefit from it. Again, I've seen great things come out of the collaboration that takes place between providers and payers, and through a value-based care arrangement. So the reason I wanted to answer this in reverse order is because that helps us also define the roadmap at times. And so when I think of our roadmap today, one is the interoperability. So whether we achieve that through just better piping between different platforms, or us actually expanding the scope of the services and the scope of solutions that are found and that exist in the healthcare environment. So if you're looking at it from a clinical platform perspective as well, do we venture into EMR space, health record management? Again, there are a lot of great companies out there. Quite frankly, if they don't get better, some of them don't get better at interoperability, this will push us to actually into that space as well. Clinical platforms from a population health management. Again, we have some of that today, but just expanding, for example, predictive models. That's something that we definitely have on our roadmap today. And then the other thing is patient engagement. And some of it is the need of patient engagement as value-based care continues to expand and touch more and more patients. Patients are their health conditions are going to improve, or at least the deterioration of their health is going to slow down or stop. And so when you feel good about yourself and your health, you may not be as engaged. And so making sure that patients stay engaged, because it doesn't take much for something to develop in our bodies and a clinical condition to worsen without even realizing, or when it's too late. So that's really for us, our roadmap is driven by the needs that we see, the regulatory environment, but ultimately trying to bring various systems that are needed today to support a healthcare environment, bringing this into our scope.
Very good. Very good. Bruno, I want to thank you for sharing a bit about Insure Data Solutions, as well as your perspective on the broader value-based care, risk-based market. Congratulations on the success to date. And as was just apparent in your last question, good luck on the vision you have going forward. It's quite compelling.
Thank you very much, Jason.
Thank you so much. Take care.
Okay, bye.